Hey, our trust team has done a ton of great research on building trust, countering misinformation, and improving public health communication. But there's often no better expert than practitioners themselves. Stick around to hear more from my conversation with Annie, Justin, and Seely discussing their experiences at Public Health Seattle and King County. Okay, so today I get to talk to some really incredible folks from Seattle King County Health Department about their partnerships, including their incredible Community Navigator program. But first, let's go around and please introduce yourself and describe your role with regards to public health communications for Seattle and King County, Washington. And we're going to start with Justin.
Hey everybody, my name is Justin Jeffrey. I use he, him pronouns. I work at the Office of Equity and Community Partnership, where my colleague and I, Seely, are program managers for the Community Navigator program. And I will pass it to you, Miss Annie Kirk.
Hi, all. I'm Annie Kirk. I am with our communications team out of the director's office here at Public Health Seattle King County, and I manage our external and community partnership communications. So I work very closely with Justin and Seely and our community navigators.
Hi everyone, I'm Seely. I use he, him pronouns, and I am a project monitor with the Community Navigator program along with Justin.
That's great. Can you tell me a little bit more about the Community Navigator program? How did it come about? And what has been the impact of the program in terms of building trust, countering misinformation, or otherwise just facilitating public health communication?
So the Community Navigator program started after COVID-19, early on in about February of 2020. It has been co-created and trusted with community representatives. Our community navigators, they serve as representatives for their communities to provide cultural responsive information and resources. At the start, it was around COVID-19. We are now in 2024. We're still dealing with COVID-19, but we've also transitioned to address the social determinants of health and provide guidance here to public health. So I don't know, Celia, if you want to tap into that, but that's kind of really where we started in 2020 and kind of where we're at right now. A lot of in-betweens though.
Yeah, just to build off of what Justin said, currently right now we have about 26 navigators who speak about 45 different languages. And as Justin mentioned, we've shifted to addressing social determinants of health. So our navigators do a lot of co-creation work. They help with translations. They sit on subject matter expert panels within public health, both and also with larger King County. So we have folks who've worked with King County Metro, Department of Natural Resources, and Parks. So again, these are trusted community leaders in their field. So the thing that we like to say here is they're going to do the work anyways. So through the pandemic, we've given them a seat at the table, and as we've our COVID funding has expired, we've still found ways to partner with these folks and continue to use their expertise to speak in on culturally appropriate ways of disseminating both communications materials or other larger King County projects or ideas to make sure that different ethnicities and races are not missed.
And I will say as well, the space that we have here is a positive space. It's a space where we can meet and learn. We partner with health boards as well. So we have, like Celia said, 26 navigators. Some of those folks are independent contractors, and some of those folks, represent a larger health board. So at the beginning, we recruited and vetted folks via just word of mouth. At the start of the pandemic, things were just kind of happening so fast. We started with a team of about 6 community trusted folks, a lot of grassroots individuals. And at the end of 2020, we ended with about 30 community navigators. And then fast forward, till 2022, we actually opened this process up online and got folks to apply, which has then led us into 2024, where we've maintained a team of about 26 navigators. Our folks, represent some of the hardest hit communities here in King County. We have a large focus in South King County, but we definitely, work on the east side, Central District, all the way up north as well. But really just wanted to hit that home that we represent some of the hardest hit counties or hardest hit communities here in the county. We always have gaps. There's gaps even in the program that we currently have right now. But that's why we partner with a lot of our folks who have been in the community for 20 plus years. So we're giving them a seat at the table. And this is one of the first programs to actually do so, to pay, BIPOC individuals for the work that they're already doing. They're doing work for us in the community. We're partnering alongside them, and we're getting them a seat at the table here at the county to talk about what's going on in their community, to talk about policy, to work with Annie around communications. And I think that might be a good segue, because Annie's work with, the comms team has really kept community safe. It was very collaborative. And I think that is some of the high level things that we learned during the pandemic was that collaboration piece. But I'll end there.
Yeah, I think for the communications team, having the opportunity to connect in a space throughout the pandemic, to not only like push out resources that we put together, but to really get input and to co-create a lot of the information and the resources that we put out, to get a better sense of the types of formats that worked well for different communities. And what I've found to be most helpful of working with our community navigators is that we get a really good pulse of what's happening in different communities, and the types of questions that are coming in from some within the Somali community may not reflect what we're hearing from our Vietnamese communities in the area. And so we were able to really shift in having community-centered communications come out from our department to answer those top-of-mind questions and to really try to address that before, otherwise, we would just be putting out communications that we think were necessary at the time. So it's been really valuable to be able to actually co-create this work and to get that engagement from the very beginning when we're planning some new communications resources to go out.
That's incredibly exciting. I think that's something a lot of health departments really aspire to do. So, new question for everyone. What have been your most important lessons learned regarding forming successful community partnerships?
Paying folks for their time, I think, has been one of the most important lessons. We've been very extractive in the past of how we've tapped into a lot of BIPOC community leaders getting information. So, putting the dollars behind that, capacity building as well. For me, I think it's been one of the most important lessons. Trust, building that trust, bridging that gap between, community and government has also been very important. I don't know, having fun is another thing. Like, we have a very tight community in our program. We've come to know these folks for the past 3 years. And life has happened in between. We've had some very big moments, not just around the pandemic. We talk about, the Black Lives Matter movement, anti-Asian hate, and we've had, natural disasters and all that jazz. And that's just a reflection on just life in general and how that has played a part into the work that we do. I'll stop there, and I can probably build off what Annie and Celia are going to say as well. I echo a lot of their thoughts.
I would absolutely say, paying people for the work that they're doing, putting that money back into community. As Justin and Celia mentioned, our community navigators were already serving their communities anyway, and they were going to regardless. And so building this network where, we can compensate people for the work that they're doing to reach communities that typically are, local government either hasn't been able to reach or hasn't even considered putting the effort to reach those communities in the past. So compensating folks for their work, in addition to also building capacity among those you're working with. I think some of our projects that I think have have done really well, especially when it came to like the final communications project that we got, was when we were providing training to our community navigators to do simple video PSAs about COVID. So our staff here at the health department did a training to show our navigators how to make these videos. We provided some overview talking points about some important things about COVID vaccines that we wanted people to share, and then they were able to record those videos in their own languages, using their own words around it, and hitting on these talking points, and then we're able to share those with their communities. That's how we knew that then those videos were going to have a better reach than us putting our health officer or someone else in a video and then sharing those out. Even if we did put those videos in language, the spokespeople didn't, they weren't from the community and they weren't recognizable to community members. And so, doing projects like that have been really valuable, and I think helpful for many across the department to see why it's so important to not just make something and get feedback from community, like if this flyer, if this video seems to work for them, but really engaging community from the planning stages of your project.
I mean, I think I'm just adding on to both Justin and Annie around pay and compensation, but making it equitable. So I think for the folks who are wondering how we came to our hourly rate that we did is we took a comp of 3 similar organizations that were in our district or in our area. So we used like City of Seattle Community Liaison Program. They had a similar program, but they don't use and utilize their navigators like we did. We have a program here called Best Starts for Kids, who has a similar community program. So we've taken that and we created a competitive rate and an equitable rate, knowing that these are contractors, so they pay their own taxes. They do a lot of that stuff. So creating a pay that both honors their time and their expertise, right? And they might not have like certifications or college degrees, but these folks speak a lot of those languages. So as Justin and I mentioned, we have 45 languages spoken, right? So they're able to disseminate the information that we give to them, in a unique way. And then some of the other things that we do is we're present, we show up. So our team typically has from 20 to 30 tabling events or community health fairs and resources events. So we go there too to represent public health and also come alongside our BIPOC community to let them know, hey, we're here too. We're going to bring our, PPE, bring our other, public health type materials to show that we give our support. And then, tapping on Justin, we've been with these folks for so long. We are like a family. We go to their events, not just like public health events. They've invited us to like their private, we are intrinsically immersed into their family. So they think of Justin and I as, as part of them. So they always invite us to personal things. I'm like, bro, it's not work. And they're like, no, it's more than work. So that's the one thing I would say is just we built this trust so much that, it's going to be interesting when we open this up again and look for more other communities. As Justin said, we do have gaps. We identified that. But it's the trust that we've built here that's been awesome.
So great to hear, and definitely seems like very important lessons learned. Okay, so now to our final question. What's your final advice for health departments who want to form or improve relationships with local community-based organizations? How do local health departments get from where they are to a success story like the Community Navigator program?
So I'll just jump in and start. I think for us, what I would suggest would be that co-creation part. That piece is very important. You can sit there as a health board and come up with your own plan with what you think community needs, but really tapping into that co-creation is going to make us a very successful program. And that is something that I think we've been able to foster and kind of kind of do, because things change, right? Things change from where we were in 2020 to what we're doing now when we switched over to the social determinants of health, but we kept that co-creation just at a maximum. We came up with a mission statement. We really were, following the lead of our community navigators, of the folks that we partner with. And that was, it didn't happen overnight. That was on the span of like 5 months that we really came up with that co-creation piece of this program. And then, understanding what your role is. So you're going to meet with community and you're going to be talking about high level concerns, and, how are you taking those high level concerns and pushing that up to leadership? Whether that is just how you're maintaining it by writing things down, or by, having meetings with leadership, but those high level concerns, that we've kind of gathered throughout the start of this program, we've seen some real change, and some of the things that the community was telling us. I think one example was at the start of the pandemic, folks, the county was really pushing out a lot of mass vaccination sites. Hearing back from community that these weren't what community wanted. They wanted like very small, independent, culturally relevant vaccination sites. And we were able to take that concern, and then a lot of moving parts behind it, but then we were able to have vaccination sites, a Khmer community vaccination site, a Somali vaccination site, where we saw our numbers, climb up. Or we're hearing that white masks are not good in some Asian cultures because they represent death. We're able to elevate that and kind of, shift our approach. And we've seen that, play out throughout the course of this program. But yeah, and also just understanding that there's a lot of just like digital access, health literacy, language access barriers, and you're kind of the in-between for that and try to mitigate that, especially around language access and digital access. I think being able to be that, the who we are, Celie, Annie, and I, and be able to take those problems and work on it for community. Their role is not to, try to navigate the system. That's our role. And I will end there because I don't want to keep talking, but thank you for hearing me.
To build on that, I think what a lot of, our department, did this as well. There, in terms of the way that they approached community engagement, it would be, coming to the community with like a survey or a needs assessment, or bringing a product and then just asking for feedback. So a lot of extraction from local communities to get information in, and then not actually like closing that loop back to communities to show like what they did with that information, or how did that change a program if it did, or what did they do with that. And I think it's really important for health departments to build more of a relational transaction with communities versus this extraction, of actually listening to what the needs are of a specific community and then acting on it. I think that that's been something that's been, so helpful for us here, and to educate others in the department on something as simple as like, a booster campaign of noting that, yeah, for these communities, we're actually providing something. We're going to provide videos for this. These flyers work really well for this other community, and we're going to be giving talking points to this community, and they didn't, and for them to be able to record their own video memos to send out to their community, or videos, that was going to be more impactful to get that message out. We can only get there by actually having relationships with these communities, with community leaders, to know what's going to work best, and really just following through. Like when requests would come in, we would do everything that we could to actually deliver on providing information about something that's being asked. And then I just think the next piece of that in building these relationships is being really transparent. There are some times that I'm going to to our community navigators in these meetings and saying, okay, look, I want to be upfront from the beginning on this. We don't have as much flexibility with this campaign due to how the funding is coming in, or there are these specific things that we know we have to do, which I know isn't ideal. We're not going to have flexibility on this. That being said, do you want to help advise on this to be able to adjust as much as we can? Or it's totally fine if you don't want to participate in this project. We'll be providing that feedback back to our funders, because again, it's like, spreading the education around this as to why we weren't doing co-creation on this, because one wasn't possible, and why the community engagement around this wasn't as strong as some of our other work, because maybe this was not an issue compared to other things that we needed to work on that was a priority for these communities. So I think that transparency and really truly building relationships where you're able to deliver things back to the community and include them from the very beginning is incredibly important.
Number one, it's okay to start small. So, you don't have to touch every community. So as Justin mentioned earlier, we started off with 6, right? And then also with that same narrative, it doesn't have to be the tier 1 folks. Again, here at King County, we have these tier systems. Is it fair? Obviously not. But, I think that was like Latinx, Chinese, and then some other populations. But, you can identify maybe some of the historically marginalized BIPOC communities who've been hardest hit by, whatever issue or problem that your health department is dealing with. So yeah, you can start with a small number. And then the second thing is, depending on the funding, right, I would tell folks to try to figure out what the permission to play rules are, what the red tape is, right? Try not to circumvent internal controls when you're trying to create these contracts with your navigators. Thing is, Justin and I have been able to really try to figure it out for them on their behalf to see how much we can stretch kind of our funding to do culturally appropriate things, but stay within the guidelines of what public health wants us to do, relative if it's federal funding or internal general funding that we get. And the third thing I would say is, hire folks who look like those folks, right? So Justin represents the LGBTQI community. I am Samoan, Pacific Islander, right? So it's okay to hire BIPOC program managers. The interesting thing about public health that I've been here is that they love the whites. So there's a lot of white folks who work here, but it's all right to hire some people of color, right? So though I don't have like degrees or letters, I love going to those meetings. But I have like 15 years of grassroots community development nonprofit work. So I have a array of different CBOs that I've worked with, which has made this process easier. So when we go and do breast cancer and cervical cancer awareness in the Pacific Islander community, these are one of the issues that we've dealt with. It's easier for them to come to myself. I can unload like 11, 12 Pacific Islander nonprofits who can then start addressing that issue, just because the relationship is built. And a good chunk of them are my navigators. So yeah, those would be like the 3 things that come to mind when I think about if other health jurisdictions want to start this type of project, right? It's okay to start small. Know the rules of your grant or your funding source. Hire some folks like Justin and I, and Annie too. Annie represents the Native Indigenous community. So it's cool to sprinkle in some POCs out there in those predominantly white health districts, but I just had to name it, put it out there.
I feel you guys have given some really great advice to health departments here. And Justin, I think you wanted to add something as well.
Lower my hand there. Although you're talking to Annie, Seeley, and I right now, there's a large team behind us. There's been a large team who have supported this group since the beginning of implementation of this group in 2020. And that is kind of what is needed as well. We can be advocates for a community, but it takes a lot of moving parts. The funding as well. You need someone to believe in the vision that you have, believe in the co-creation process, and it took a lot of people to get us to even to this meeting today. So I just wanted to shout out that.
Fantastic. And Annie, can you speak a little bit more about how these community partnerships have helped so much in terms of countering misinformation?
Yeah. So the fact that we already had strong relationships with our community navigators, and so in then also with these communities, it made a huge difference when we were hearing misinformation from other, more broad sources. To bring that, I would attend these meetings to bring that to community navigators, to ask if they were hearing similar things within their own communities. I would provide, the statements behind them, like what is actually true, to get a better understanding of what these misunderstandings are or misinformation that's circulating more broadly. And what was so incredibly helpful was that our navigators would bring, different rumors or misinformation or misunderstandings to us, so that then we could respond, or we could adjust some of our resources if we're realizing, there's some confusion around something, or this isn't touching on something that's really important to those communities. And so having those relationships in place, our navigators trusted that we were giving accurate information. We could provide kind of the background and how we thought maybe this is being misinterpreted, or what's happening, around that rumor that was circulating, and then provide a resource or talking points back to navigators so that they could share that information with their communities. If I had gone on a video and was just sharing information, that would not have been as impactful as having people from those specific communities actually sharing that back with their own family and their community members to get the word out.
Yeah, I'll go after Annie. I think first having a space, having an inclusive space where you can talk about misinformation, you can talk about stigma, you can talk about trauma. You fostered an environment that feels safe, safe enough for community navigators to talk about what they're hearing in their community. Right? They're representing themselves, and they're representing hundreds and thousands of other people behind them, and whether that be in their community or just King County as a whole. So what we're hearing, is coming from community behind them. They're telling us what they're hearing, what folks are actually talking about. And we've been able to shift some of our FAQs around that to address those things. We've been able to, as Annie said, highlight videos from folks in community to really just be a little bit more thoughtful in our process and impactful. Yeah, I think maybe I'll end there, but I think really it begins with the space that you create. You want to create that environment that doesn't feel extractive. It feels safe. It feels safe for people to even begin that conversation. Yeah, that's all for me.
Yeah, and like even in our one-on-one meetings that Justin and I have with folks, and in our larger community navigator, at that time it was weekly. During COVID meetings, we met weekly. Then we switched to bi-weekly. Now we're at monthly. We'd have tea time, so everybody know what the tea is, and we would say, "Hey, man, we're hearing this. Is that true for your community?" But if it wasn't, right, they'll bring up some whole other random tea that's going on and be like, "Nah, this is what we heard, though." Oh, is that really happening? Let me go check back with our other team to see how all that information correlates. And then we would go back. So a very reciprocal relationship said, no, actually, this is what's happening. So, even in the midst of COVID, when they said they were putting trackers in you, they were doing all that stuff, we were able to partner with different folks. But I know we had some people from where was that? Justin from Fred Hutch, who came in and talked about how they built the vaccine, what mRNA was. So they were able to come and tell our team, hey, let's go ahead and squash all that. This is what's happening. And the cool thing is, if we needed to, they would go to that community navigators community meeting. I know we had a few in Dari, Pasto, and Swahili, so the Kenyan community, where we brought in those doctors, they were able to communicate. And the nice thing is having the navigators, they were able to, it wasn't simultaneous interpretation, it was consecutive. So they were able to pass that information on. So that's the great thing about our team, right? So Justin and I will tell them things, but then they will report back to actually, nah, guys, this is what's happening. And even around childhood immunization. So, as Annie mentioned, we had some navigators who actually, again, look like the community presenting these these doctors' information, but it would be like Lena from the Afghan community saying all this stuff in her language and then sharing it out with her folks. So they had a better understanding of, oh, cool, yeah, we have this advocate Lena who has a seat at the public health table and talks specifically to these doctors, so they can kind of quash all these kind of concerns, right? And then it's again very reciprocal. Some of the hot tea we get from folks are like, man, did that really happen though? But you got to take their word for it, right? Because then if Justin and I don't go back and report what we call community concerns, hey man, what we're hearing on the streets is X, then they won't share this information for us. So again, that mistrust relationship is we provide the info, but then they report back. So it's been a fun relationship that we have with our community navigators. And again, it's what we call tea time because they do share.
Just to add one more thing as well about just our program. So when we implemented our program, English was never a criteria for the program that we run. So we have a lot of Spanish-speaking folks. We lead a lot of our meetings, monthly meetings. We have Spanish simultaneous interpretation, and that is very important for us as well. Spanish is a big language here in King County, so leading with that is another way for us to be accessible to the folks, especially around language access. We also host a meeting once a month where we have ASL, Somali, and Spanish simultaneous interpretation, where we get information out to over 1,200 community partners. Just kind of wanted to add that because I think that is a pivot that we did at the county, and especially with this program. It was to access, independent contractors, grassroots leaders in a very low barrier way. We have to deal with a lot of the fine print behind the scenes, but we're not pushing that back onto community. We learned a lot at the beginning of the pandemic, how to partner with community. And instead of going back to the way things were in 2019, where, it was hard to contract with community. It was hard, to get community at the table. We're taking those lessons learned that we did at the beginning of the pandemic and keeping that kind of alive as we roll this program forward. And language access, digital access have been a big success for us. And I just kind of wanted to plug that in there.
Great. Well, thank you guys so much for your time. And I'm really excited for people to be able to watch this back. Thanks so much again, and have a great day.
Thank you, Christina, for meeting with us. I appreciate it.
Thanks for watching. And for more information, go to our Trust in Public Health website.